During the pandemic, there has been an alarming rise in addiction, which has only increased the demand for treatment facilities, especially in rural areas like the Adirondacks. Our Jack LaDuke this week shows us a new detox center that's opened in Saranac Lake to address that need.
This recently renovated warehouse in Saranac Lake offers windows of opportunity for anyone suffering from alcohol or drug addiction. Operation comes under the umbrella of St. Joseph's Addiction, Treatment, and Recovery Centers, also in Saranac Lake.
What this region did not have was detox beds so that people wouldn't have to go to Syracuse or Albany to go to detox bed.
This region has been needing these kind of services localized because many people that struggle with substance use problems don't necessarily have the ability to travel great distances and such. So having a localized asset like this is very important.
Part of what we wanted to do was create a space in which people coming for detox, which is a really difficult point in a lot of people's lives if they're going to begin recovery, they're medically and emotionally in a very difficult state. So we wanted to create a physical space that would be welcoming, that would make them feel that they were going to be treated with dignity, which is a very important part of our mission. St. Joe's competed effectively for a grant a few years ago to get the money to be able to purchase and renovate what was a warehouse into this really wonderful space.
The $3 million plus grant was enough to make the building inviting to patients and to the public. 10 patient beds are available in the center.
Well, when they come to detox, they're basically stabilizing, and sometimes you hear detox used as a stabilization service as a terminology. They're getting two things. They're getting to be safe and an environment in which they get medical care and initial counseling so that they are able to be safe at that very difficult point where they might be unable to keep themselves from further medical deterioration or be in a susceptibility to an overdose or an overdose death.
Alcohol use rates have soared, overdose rates have soared, and that's just since the pandemic started.
Living in the isolated Adirondacks, detoxification treatment is hard to come by. The pandemic promoted isolation, and isolation is where addiction has a strong foothold.
The other part that's really important is that sometimes when people have gone historically to hospitals for detox, they get the medical assistance that they need. What they don't get is an initial connection to the beginning of a treatment connection.
Statistics have shown that individuals that go to, for example, the emergency department for detox services, there are only about 17% of those actually go on to some kind of formal treatment following that treatment at the hospital.
By virtue of the way in which our program is set up here, they're able to connect with counseling services, and in many cases, people will be going from this facility to our inpatient facility in Saranac Lake, or in some cases to other facilities as well, but they'll have had that initial connection.
Detox facilities like the new Bob Rice Community Service Center will help relieve pressure on most crowded detox centers. And there is a plus. Patient costs at clinics are less than at a hospital. For Mountain Lake Journal, I'm Jack LaDuke in Saranac Lake.
Jack LaDuke's Adirondack Journal on Mountain Lake PBS is made possible with support by Northline Utilities.